Hello, everyone. Hola, bonsoir, buonasera. I'm Dr. Gina Friel. I am a pediatric nurse practitioner and director of the Global Nurses Working Group at Columbia University Mailman School of Public Health in the United States. I welcome you with great pleasure to session 10, our final session in nursing on the front lines of the climate crisis, education for action. Our topic today is climate change and health equity. In a moment, we'll be hearing from nursing expert Dr. Suellen Breakey. I would first like to express my gratitude to our partners and supporters and all that have had a role in the development of this course, especially Haley Campbell, Dr. Michelle DePhillips, Dr. Karen Duderstadt, Nico Hamacher, Dr. Cecilia Sorensen, Daniele Maganienz, the Global Nurses Working Group, the Alliance of Nurses for Healthy Environments, the Canadian Association of Nurses for the Environment, the Climate Action Nurses in Australia, the California Nurses for Environmental Health and Justice, the Columbia School of Nursing, and the M. Louise Fitzpatrick School of Nursing at Villanova University. We are grateful for your partnership and support. First, a few reminders for today. As you know, attendance will be automatically recorded during this live Zoom session. The video recordings will also be available following this session through the YouTube on the Alliance of Nurses for Healthy Environments platform at learning.envirn.org. Participants who attended the live webinar sessions on Zoom will be provided a password which allows them to bypass the video viewing requirement. And listed here on the right-hand side of the screen are the dates in Eastern Standard Time that the passwords have been sent out for all of the previous sessions. In general, please allow 2 to 3 days for this information to be received by email. And don't forget to check your spam, as we know things can sometimes end up there. Continuing education will be provided through the Alliance of Nurses for Healthy Environments. In order to receive continuing education, 1 CE per individual webinar, participants must have attended the live webinar session or view the recording asynchronously and receive at least an 80% on the post-session evaluation. Participants do not need to complete the continuing education process in order to receive a certificate of participation. Certificates of participation are provided to participants who attend at least 7 out of the 10 live Zoom sessions or view the recordings asynchronously and pass the course final exam with a grade of 70% or higher. Certificates will be issued on December 17th through the 18th from the website listed here on your screen. It is a do not reply email. And one note, please join the Zoom sessions, the video recordings, the post tests, and of course, surveys and final exam utilizing the same email address. The final exam is a 20 multiple choice and true false questions. The exam link will be sent out with the final video recording via email, and it will be posted on WhatsApp. The exam will open on Thursday, December 5th in 2 days at noon Eastern Standard Time, and it will close next Tuesday, December 10th at 11:59 p.m. Eastern Standard Time. Participants must take the exam in one sitting, but there is no time limit to taking the exam. One final session about today. Please put all questions for Dr. Breakey in the Q&A and not in the chat. And now it is my honor and pleasure to introduce Dr. Suellen Breakey. Dr. Breakey is the director of the Center for Climate Change and Climate Justice in Health and a distinguished teaching associate professor in the School of Nursing at MGH Institute of Health Professions, where she teaches in the Doctor of Nursing Practice and Accelerated BSN programs. Her clinical background includes cardiac surgery, critical care, hospice care, and global health nursing. For over 10 years, she was a leader with Team Heart, a nonprofit organization that provides rheumatic heart disease screening, cardiac surgical care and follow-up, in addition to patient and provider education in Rwanda. Dr. Breakey's scholarship interests include the impact of climate change on human health and well-being, bioethics, and global health ethics. She is a co-author of Global Nursing in the 21st Century, which was published in 2015. Dr. Breakey has co-chaired the National League for Nursing's 2022 Vision Statement on Climate Change and Health. She has published numerous papers and has presented at conferences and industry events locally, regionally, nationally, and internationally. It is my pleasure to welcome Dr. Breakey today.
Thank you very much, Gina. And welcome everyone. I'm just going to share my screen. Michelle or Gina, can you give me a thumbs up if you can see my screen? Thank you. Okay. All right. Well, welcome everybody. It's noontime here on the East Coast of the United States. I'm sure it's looks like we have a pretty diverse audience from I wrote down a bunch of different places. So today we're going to talk about climate change and health equity. So the learning objectives for today that I hope to touch upon include describing the concepts of climate justice and environmental justice, identifying social and environmental determinants of health that make individuals and communities more vulnerable to climate-related health impacts, evaluating health inequities related to air pollution exposures in communities and populations with adverse health impacts from excessive exposure to air pollution and other environmental injustices. And I also wanted to identify some resources that can be used to determine factors that contribute to health inequities. And these are kind of US specific, unfortunately, for those colleagues that are from outside the US. So if you've attended these sessions, I'm guessing you've probably heard that climate change is an urgent public health issue, and it's also a health equity issue. According to the World Health Organization, currently there are 2 billion people who lack safe drinking water globally. 600 million experience foodborne illnesses. 30% of those are children under the age of 5. In 2020, 770 million people experienced hunger, and 3.6 billion people are living in areas that are susceptible to climate hazards. We also know that, according to the World Health Organization, between 2030 and 2050, there is expected to be an additional 250,000 deaths per year from undernutrition, malaria, diarrhea, and heat stress. And we know that countries and also areas within countries with weak infrastructure are least resilient and have less ability to respond to climate impacts. And that infrastructure includes a strong healthcare sector. So this slide shows you two things: the number of reported deaths by decade related to climate change and also reported economic losses by decade in US dollars by the billion. So if you look at the graph on the left-hand screen, you can see that deaths being reported have gone down over time. But what you can also see is that the increase in extreme temperature, deaths reported related to extreme temperature are rising. And those are mostly extreme heat events. On the other side of the screen, you can see a bar graphs looking at the reported economic losses by decade. And so from 2010 to 2019, that's 1.4 trillion deaths, or close to not deaths, excuse me, dollars. So it's reported in billions, but it's roughly $5 trillion in economic losses. The other thing I think you can see pretty clearly is that the economic losses are, kind of going up with each decade. And so that's really important to think about also from an equity issue, because we know, as I mentioned in the last slide, that those areas that are least resilient, usually low and middle income countries or low socioeconomic areas within countries, are those that are most impacted and have less resources to become resilient. This is a little bit of a busy slide, but what it's showing you is what the concept of climate justice looks like from a greenhouse gas emission standpoint. And so if you look at the second circle closest to the middle, you can see that the top 10 emitters are responsible for roughly, I'm guessing here, about 67% of all greenhouse gas emissions. And we know that that's China, the United States, the EU, India, Russia, and you can see here Japan, Brazil, Indonesia, Iran, and Canada. But you can really see that China and the United States and the EU combined and India really account for, even within that group of 10, a considerable amount of greenhouse gas emissions. And so climate justice is the concept that those who contribute least to greenhouse gas emissions, so all those little countries that you can, barely see here, are the ones who bear a disproportionate amount of climate-related health consequences and the impact of climate hazards on their infrastructure as well. And this, I put this here to remember, the World Health Organization called it, it's these climate justice communities and countries that are hit first and worst. And I think that really is a good way of, kind of telling that piece of the story. This is from the National Institutes of Health in the United States. And so this came out in 2022, so forgive me for not putting that here. But the National Institutes of Health recognized a few years back that climate change was impacting health in negative ways, and that we didn't know enough about this, and that we really needed to study it more. And so they're providing funding across all institutes to look at climate change and health. What I like about this model is that it shows you that climate change is inextricably linked to social, behavioral, environmental, and actually economic determinants of health. And the way they've layered the impacts of climate change right on top of the social determinants of health, I think is really important to consider. Because, again, if you don't have access to good healthcare, strong healthcare systems, if you are living in poverty, or you're housing insecure, or you don't have a home, if you're an immigrant for whatever variety of reasons, if you don't have, strong infrastructure, and depending where you live, these things all impact how you respond to the impacts of climate change, climate hazards, and also the health impacts. And so I think it was 2023, the NIH actually they've created a climate and health scholar for each of the institutes at the NIH. And so my colleague Patrice Nicholas was the inaugural climate and health scholar for the Institute of Nursing Research at the NIH. And so really each of these climate and health scholars, and this is continuing, are working with the NIH to figure out, to educate them about the impacts of climate change, and then also to think about what we need to do in terms of research, which you can see kind of down here at the bottom of the slide. So that was, I would say, a pretty significant step within the United States to really recognize this as an important issue that we need to address. I wanted to mention, I'm sure many of you are probably familiar with the COP meetings, the Conference of the Party meetings. And so these meetings are held yearly, and they are representative of the countries that participated in, and are bound by the UN Convention, Framework Convention on Climate Change. And they began in 2015, and this occurred at the same time that the Paris Agreement came into being. And so just for those, as a reminder, the Paris Agreement is a binding, legally binding agreement between the nations the parties who were part of the Conference of the Parties, and that includes 195 parties. The goal is to decrease greenhouse gas emissions, to keep global temperatures to well below 2 degrees Celsius above industrial levels, which is kind of confusing. But really the goal is to keep those, to keep that 1.5 degrees centigrade above pre-industrial levels, to try to lessen the degree of global warming is essentially what the goal of the Paris Agreement is. And it's also to provide financing to low and middle income countries to mitigate climate change, strengthen resilience, and increase adaptive abilities. So with that in mind, I just wanted to mention COP28 and COP29. COP28 was held last year, and it was the first time that there was an inaugural health-themed day. And so 143 countries signed a declaration on health and climate, which is a really important and significant step. And there was also a dedicated health target that was put into the final global goal of adaptation. And the health target was attaining resilience against climate change related health impacts, promoting climate resilient health services, and significantly reducing climate related morbidity and mortality, particularly in most vulnerable communities. So while this was an important step forward to recognizing how central health is to thinking about climate change, mitigation, adaptation, and resilience, no health indicator has yet been developed to actually measure this particular target. So at this point, it's not measurable within the COP meetings themselves. COP29, which just ended a few weeks ago, was a little less positive in certain ways. And so wealthy countries agreed to deliver, I think after much discussion, agreed to deliver $300 billion in climate aid annually by 2035 to lower income countries. The last time, with the last agreement, it was $100 billion, and that was, I think, in 2009. And so some of the people who aren't happy with this particular agreement, say that when you account for inflation, that number is not very high. The other thing to really consider is that the need, and we looked at that on my, the former slide, we saw that losses were around 1.5 billion, and here they were asking for 1.3 trillion annually. So you can see that what was agreed upon is $1 trillion less than what they had been requesting. And so this is an equity issue because we know that the money, the people who are requesting this money are lower and middle income countries, but also island nations who are being hit really, really hard because of the sea level rise and extreme storms. So this was not, there were many nations and countries that were not happy with this final agreement. And that was just a few weeks ago. So we'll see what's more to come on that. But we also know that, based on that bar graph I showed you, there will be, and the losses will be exacerbated with as we see more severe climate impacts. And so this is just one example, and this is a chart which is looking at the Latin America and Caribbean area. And so while they generate 10% of greenhouse gas emissions, they have significant effects from climate change, including worsening storms, floods, sea level rise, drought, and they're just being hit extremely hard. Between 1998 and 2020, climate-related events killed 312,000 in that area and affected more than 277 million. And their adaptation needs were estimated at 100 billion alone, just in that one area. And down in these bar graphs, you can see they kind of separate out areas within Latin America, and you can see the Caribbean is the hardest hit in terms of how much the cost of these natural disasters are really pulling from their GDP. Let's see. So this is from the United Nations Development Program, and this is called the Human Development Index. There are a series of these. I included here the Inequality Adjusted Human Development Index, and this is from 2022. But as you can see, what this is, it's a measure of the key dimensions of human development. So what really contributes to our quality of life? Good education, decent standard of living, adjustment for inequalities in these dimensions. And the higher values indicate better outcomes, higher and more equal human development. So the darker, the richer, the blue, the better off the people living in those areas are. And they don't account for within country differences. So it's really just looking at the total country. And so you can see here, not surprisingly, in some ways, which countries, and many of the people on this call, I noticed were from Africa. We have some people from the Caribbean, Latin America area. So you can see, I think that this just shows you at the outset that there are inequities globally, and we all know this. But then when we think about layering on top of that, the inequities related to climate change, you can see that that's going to exacerbate poor health within these particular regions that have lower HDIs. So who's most at risk for health impacts of climate change? And this is from the American Psychological Association and Eco America that put out a really great mental health, like a white paper really of the mental health impacts of climate change. And it's very comprehensive, but it really points out that we know the very young and the very old are at risk. We know that women in general are at risk, and pregnant people are at risk for both environmental justice issues and climate justice issues. in terms of poor pregnancy outcomes. Children are at risk for a variety of reasons. One, because they are smaller, and two, because they are reliant on adults to care for them. And so when adults are being impacted, particularly from mental health climate related issues, that puts children at risk as well for child maltreatment. It puts them at risk for child trafficking, kids who are having to move away or migrating, immigrants. Socioeconomically disadvantaged communities and populations are at risk. Indigenous peoples are at risk, particularly because of their connection to the land, but also their reliance on the land for their food and other, they have a connection that's much deeper, and their resources are being, destroyed. Certain communities of color, those living with disabilities, those who are housing insecure, people who have chronic physical and mental illness are all at risk for increased climate-related health impacts. So I wanted to mention the Lancet Countdown on Health and Climate Change. And so this has been published every year since 2015, again, around the time of the Paris Agreement. It tracks 53 indicators across 5 domains, and those domains include climate change impacts, exposures, and vulnerability, adaptation, planning, resilience for health, mitigation, actions, and health co-benefits, economics and finance, and public and political engagement. So the group who get together yearly and they track these indicators, they're an international multidisciplinary group representing 57 academic institutions and UN agencies, and they together comprise over 122 leading experts. Some of those people are, part of the GCCAG, as a matter of fact. So this provides a global picture of how we're doing from a health perspective related to climate change. And then some countries, for the United States example, will have a group of experts get together and look at these indicators and then create a brief for their specific country. And so this just came out a couple of weeks ago, usually comes out in the fall, early, mid to late fall, and then a US brief comes out as well. And as I said, other countries put together briefs as well. So 10 of the 15 indicators this year, 15 indicators this year reach new records, meaning they've surpassed in a negative way how things are proceeding. And global energy-related CO2 emissions actually reached an all-time high in 2023. So if you think about the Paris Agreement and the efforts and really what they're calling for is more aggressive efforts to decrease warming, that can't happen in the face of increased CO2 emissions. And so something's got to give here. And the name of the report was Facing Record-Breaking Threats from Delayed Action. And so the 2024 report is really, they're really ramping up their suggestions about being more aggressive to try to limit greenhouse gas emissions and global warming. So the key messages from the report, and there were 3, are that people globally are facing record-breaking threats to well-being, health, and survival, that governments and companies continue what they call fueling the fire. So in other words, we're not making a lot of progress on reducing our greenhouse gas emissions, and fossil fuel funding needs to be urgently redirected to actions that benefit health and well-being. And that would include renewable and clean energy. So I just wanted to provide, again, there are 53 indicators. I wanted to just provide a snapshot of what the 2024 report showed. So in terms of extreme heat, Infants and adults older than 65 years experienced an average of 13.8 heat wave days per person. And that's significant because we know that the very young and the very old are most susceptible to heat-related illness. And we know that particularly in older adults, that number is heat-related morbidity and mortality are increasing and have increased in the United States has doubled over the last 25 years. And it's important to note that theoretically it's preventable, and heat is the #1 health impact from climate change. 512 billion potential work hours were lost, 63% in agriculture. And so this was higher. The hours of work lost was higher in low HDI countries. And so that just underscores the inequity there. And it also points out that, you know, in these areas where they're losing potential hours work, particularly in the agricultural setting, that's impacting food production in probably areas that are already food insecure and, you know, experiencing more food insecurity and hunger. 6% more hours of sleep were lost on average than during the time period between 1986 and 2005. So I pointed this out because it's a new indicator. It's most likely related to heat. But we know that sleep is an important part of good health. And so to begin to track how sleep relates to heat is, I think, important because it's a indicator that people might not necessarily think of, obviously. And then 31 countries experienced 100+ more days of extreme heat than expected, than would have been expected without climate change. And again, this impacted low HDI countries more significantly, which again points out the inequities associated with climate change. This is one of the charts. You know, this report is pretty dense with information, but I pulled this chart out because I thought it was pretty interesting to look at for two reasons. And so on the left-hand side, it shows the number of stressful heat days between 2019 and 2023 by HDI category. So you can see that, and then it also shows the total number of heat stress days, and the blue indicates how many would have been expected without human-caused global warming. So again, you can see here that the low HDI is really the most impacted. When you look at the right-hand piece of the screen here, this is showing average number of days with health-threatening temperature attributed to climate change in the same time period, 2019 to 2023 by country. And what's, I think, kind of, and so the darker or the deeper the color, the more heat days that were health threatening. And I think what this points out is, if you remember what the HDI, the map I showed you earlier, you can see that the very same countries that have unequal HDIs also have the same areas that are really being impacted by extreme heat. And so again, that just points out the inequities inherent in that. A few other points that were brought out in the 2024 report: economic losses related to extreme weather events increased by 23% from 2010 to 2014 to 2019 to 2023 by $227 billion. 60.5% of those losses were in very high development index countries. And the important thing to note there is many of them would be covered by insurance, although the insurance landscape is also changing because of the number of extreme weather events. But those occurring in lower HDI countries were uninsured. And so again, the losses to those lower HDI countries is more severe. 745 people currently lack electricity. And in low HDI countries, energy is primarily used by burning biomass like coal or dung. In a lot of those places, that occurs inside, which is, you know, a significant threat to pulmonary health and other types of disease. And only 2 to 3% of the energy in these countries comes from clean renewables. So when we talked earlier about the Paris Agreement and higher wealth countries contributing to increasing capacity, adaptation and resilience of lower income countries, this to me indicates that we're not doing a good enough job with that. Increased frequency of heat waves and drought months in 2022 compared with the time frame between 1981 and 2010 was associated with 151 million more people experiencing moderate or severe food insecurity across 124 countries. And this impacted subsistence farmers in indigenous peoples, particularly indigenous children, significantly. The other thing to mention about food insecurity is the World Health Organization put out a position paper a few years back about the syndemic between undernutrition, malnutrition, climate change, and obesity. And so what's happening is in areas that are very, you know, food insecure, but for two reasons. One is the micronutrients are actually changing in the food that we grow because of higher levels of CO2 in the atmosphere. But also because of sea level rise, there are a lot of people, and drought, there are places around the world that don't have access to nutritious food, and they can't sustain growing their own food. And so food is brought in. And a lot of times this food is very unhealthy, ultra processed, you know, just not nutritious in its own right. And so in these places where they are already food insecure, they're suffering from what they call the syndemic, or kind of like this idea that these things taken together have a more significant negative impact. People in these places are, you know, who live in these areas are having higher levels of malnutrition or undernutrition, but at the same time, obesity, which is contributing to increases in non-communicable diseases like cardiac disease, diabetes, etc. So this idea about food insecurity is thought to be, you know, one of the, within the climate change realm, one of the, you know, the most significant threats to us because of the lack of, you know, food sources that will continue in the face of heat, drought, and even extreme weather. This was a scoping review that I did with a couple of my colleagues, and we looked at, we wanted to know, and this is specific to the United States, but we wanted to look at what is the intersection between climate change, structural racism, and on health in the United States. And I think, even though this is US specific, I think that there are some take-home messages here. And what we found is that this included 28 articles, mostly published after 2020, which is when George Floyd was murdered in the summer of 2020. We found that the enduring legacy of historic redlining was really still contributing to inequitable climate and environmental exposures. And this was having a direct impact on health. The sub-themes we found were environmental justice impacts. So how current environmental justice impacts combined with climate change are impacting health negatively. We identified climate justice impacts. So specifically what came out of the review was around heat and the lack of resilience related to heat, and also weakened infrastructures and how these things combine to really impact health in many, many different ways. Eco-pandemic justice, which we didn't expect to see, but this came up in a few articles, was the fact that people who are already, people who are already impacted by environmental injustices did poorly during the pandemic because of their environmental exposures. And so an example of this that I can give you from my own, where I live, next to where I teach, which is a neighborhood in Boston, Massachusetts. It's a small city called Chelsea, Massachusetts, and it is an environmental justice community. It sits under the largest bridge in the Boston area that sees something like 80,000 cars a day. It's a major port for people coming in with for like regional fuel and cars. It stores all the fuel for Logan Airport, which is the large airport near us. So these are just a few of, there's not a lot of tree canopy, so it's an urban heat island. It gets very hot in the summertime with little cooling. So because of this, it's also 70% Latino, Hispanic, many essential workers. So they already have high rates of childhood asthma, for example. So when the pandemic hit, this very, very small city was hit hard, very, very hard, not only in our region, but in the country. They had a lot of deaths from COVID for different reasons. They had essential workers, and they already had pre-existing respiratory disease. They didn't initially have access to the resources that they needed, but it's also it's a city that really really organizes around environmental and climate justice issues. But that's what kind of came out as eco-pandemic injustice. The fact that people living with these environmental exposures didn't do as well. And then the emergence of syndemics, which I alluded to. And I'll get to that in a minute, but I did want to just mention here what redlining is for those who might not be aware of it. I think it was only a practice in the United States, but it was a discriminatory practice that was put into place by the Federal Housing Administration around 1934. It ended in 1968 with the Fair Housing Act. And what it did is it basically, literally, like you can see here, it took maps and it the government identified areas that were desirable to live in and those that were not. And you can see red are the areas that were highly undesirable. Yellow was the next on the list. So those were the two areas that were really impacted, and they targeted urban areas and Black populated neighborhoods. The practice, so what this meant is that people who lived in these areas couldn't get loans to buy housing, or they couldn't get mortgage loans. And so what this created over time was a racial wealth gap, where a lot of the wealth that we generate is through home ownership. And that we typically that becomes generational wealth. And so there were large areas that didn't have the opportunity to generate this kind of wealth. And so that's what created like the racial income wealth gap. From a health perspective, why this is important is because even though the practice was outlawed in 1968, the health impacts continue today and with people who live in historically redlined area, primarily because once this happened, these areas were disinvested in, their infrastructure weakened. They had there's lack of access to quality medical care in a lot of these areas. As I mentioned, Highways often cut these historically redlined communities. There are sites for toxic waste. So high levels of pollution, cancer, higher levels of respiratory disease, poor pregnancy outcomes. As a matter of fact, there was an article published in the American Journal of Public Health looking at pregnancy outcomes in one area of New York City for women today. And they have poorer pregnancy outcomes or higher likelihood of poorer pregnancy outcomes than women who live in non-historically redlined areas. So it's important to understand that this continues to have an impact through policies and practices that have contributed in not so obvious ways to people's health. And it's now creating injustices around climate change as well, because these become less resilient communities. So some of the health impacts, as I mentioned, include poor birth outcomes, higher rates of heat-related morbidity and mortality related to buildings being close together, lack of tree canopy, greater areas of concrete. So as I mentioned, not good ways for these environments to cool, and that has an impact on health. Asthma, acute MI, stroke, infertility, cancer, food insecurity, poor sleep health, as I mentioned earlier, infectious disease, and most likely neurodegenerative disorders, child trafficking, trauma. These are all things that can be related to environmental and climate injustices. So just a quick word about this concept of syndemics. People are starting to think about these more and more because so many things, we're seeing that things are not isolated. So they can co-occur in temporal or geographical contexts due to harmful social conditions, which this fits really well with the notion of social determinants of health and what really supports our health and well-being. They can occur at the population or the individual level. And essentially, when you have these things together, they mutually enhance the negative effects of each condition. So when you think of climate change and racism and environmental injustice separately, that's one thing. But when you look at them together, you know that the negative impacts are enhanced. So what are the opportunities then? And I looked to the Lancet to provide some of these. Put health at the center of national commitments to meet the goals of the Paris Agreement. That hasn't completely happened yet. Ensure that the cost of health impacts accounted for. This one I think is particularly important. Engage health professions to ensure health and well-being are promoted. Redirect fossil fuel funding to renewable energy projects and do it in an equitable way. Allocate funding to accommodate countries and communities that need it the most. And I think from what I've seen and read, I don't think we're there yet. And I think we need to do a much better job at that. Set the protection and promotion of health and well-being as the primary measure of climate action. Embed health considerations in the Just Transition Work Program to ensure sustainable, equitable, and healthy development pathways. Prioritize public health interventions to address root causes of poor health. So in other words, look upstream to see what the issues are and really design interventions around that. Build low carbon, climate resilient health systems, which I didn't touch on health systems at all, but we know that the health sector is a huge contributor to greenhouse gas emissions as well. And then at the same time, increase capacity by making climate change and health part of the core curricula in health professions education. I think it's great that this is in here. This is something that the GCCHE is all about, is trying to get the word out about climate and health education for all health professions, because it's a transdisciplinary interprofessional collaborative effort that's needed. engaging with and elevating the voices of Indigenous peoples, frontline communities, and minoritized groups, which I think is another really key thing. These are the people who are most impacted. Their voice should be centered in policy and action, and integrate health in all climate change policies at international, national, and local levels. So you can see on the one hand, we have the COP, the Conference of the Parties, where health is just beginning to be discussed. But you can see from the Lancet report, and you can go onto the website and you can download these. You can see that these indicators really, really underscore the need to really make health one of the central concepts for climate action. I'm going to stop here. I've included, and these are the tools I had mentioned. They're US-based tools. For those of you from the US, I'm not as familiar with tools, global tools. The EPA Environmental Justice Mapping and Screening Tool is a great tool that I've got some examples of what it looks like, but you can go on, you can type in an address, you can type in a city, and it gives you a whole list of indicators: climate change indicators, environmental justice indicators, PM 2.5, toxic waste. It gives you demographic and socioeconomic indicators. The CDC Social Vulnerability Index, you can go in there, type in a particular address, and it will show you how vulnerable that particular area is to natural disasters. So that gives you some information about, climate change. Air Now, which is a great resource for indoor and outdoor pollution. It gives you the air quality where you live. We all have that these days on our phones, most of us. But this also has great information that you can share with patients or students if you're educating them. Climate Check, you can go into Climate Check and actually type in an address, and it will tell you how vulnerable you are to wildfire, drought, extreme weather. It gives you a sense of what your individual vulnerability is where you live, or you can use these to, if you teach, you can provide these to students. If they're in a public health or a population health setting, or even an acute care setting, they can use these tools to educate people about what their risk is, because the first thing to helping, our patients and clients understand what they should be doing to mitigate these effects of climate change, they have to know what their risk is. And there are lots of tools out there that can help with that. This is just a screenshot of the environmental mapping tool. This is a screenshot of the social vulnerability tool. This is Air Now. This is the Climate Check. So it gives you here, your storm, flood, heat, drought, and fire risk. And then this is another tool, Measures of America, which you can go in and get lots of information about. And this is actually also a US-based tool. But those are some useful resources. I'm going to stop there. And take questions if anyone has some. I know that's kind of a lot of information. I just tried to give a high level overview, particularly at the global level. So, because this is a global issue.
Thank you so much, Dr. Breakey, for that fantastic presentation. You gave us a lot to think about. And we have some questions in our Q&A, and we'll get right to those. The first question is, regarding the United States, the incoming presidential administration is anticipated to not support activities related to mitigating climate change. Since the term climate change is negative to this incoming administration, should we consider calling it something else besides climate change so that we can still effect positive adaptation activities for the sake of people's health, especially with regard to health equity? Can you give us your thoughts on that?
Yeah, I think we're gonna have to kind of wait to see what happens. I did see, I think there was a list published of of government positions that were at risk, and a lot of them were climate related. Um, it's a hard question to answer because I do think climate change is a very politicized term. And even when we talk about it, with patients, you have to think about, it's easier to answer the question from that standpoint, actually, but, because you can just talk about wildfire smoke, you can talk about air pollution, you can talk about heat, and how these things impact you. I think, I think that from a political standpoint, the word climate change is already out there. I mean, I don't know. It will be interesting to see what happens to the Office of Climate Change and Health Equity. Maybe they'll focus more on, renewable energy and, markets for that. But I'm not sure. I think it's also new, and it's also, there's new information coming out every day. I think that there's some risk associated with keeping the viability of some of these departments going. But it's all the more reason why health professionals have to get involved, and why students have to learn about it, why practicing clinicians have to learn about it. And then what we have to do is make our voice heard, because we are the most trusted profession. And I think that's the way we can go.
I appreciate those suggestions because we, as nurses, we have an ability to meet the people where they are. And I think in doing that, we can kind of embrace their level of interest and sort of help to encourage others to be a part of learning more and becoming involved, which leads me to our next question, which is, can you provide some suggestions that would encourage nurses to come to the table and most equitably utilize the information from the COP conferences and these sessions presented here over the past 10 weeks? Can you give us a little, couple of your thoughts on that?
I think encourage your colleagues to take a look at this 10-part learning series. The Alliance of Nurses for Healthy Environments is a great organization. I'm just ending as the co-chair of the Global Climate Change Committee, but they keep people up to date on what's happening. They keep people up to date on environmental and climate policy. They have great forums around environmental health and climate change. That's one way to, I think, get involved. Before we can educate patients and clients about what their risk is, people have to understand what the risks are in general. And I think that's what the work of, this program is doing. What I find is that, I've done lots of grand rounds with nurses and interprofessionals. And when people hear the risks that are associated with climate change through these hazards, through heat, through extreme weather, through flooding, through food insecurity, all of it, through occupational exposure, they are like, wow, I never made those connections before. So really increasing awareness, if this is something you're interested in and you work, wherever you work, say, hey, could I put together an in-service on the health impacts of climate change, or, have a brown bag lunch? But I think at this point, we all have to kind of get out there and spread the word about these very real health consequences, which are direct and indirect.
Thank you so much, Dr. Breakey. I wish we had more time to answer all of the questions that have come up in the Q&A, but we are at the end of our final session, and thank you so much for this terrific presentation today, for sharing your insight with us. It has really been a pleasure to join with all of you over the past 10 weeks and learning from our colleagues and learning from our fellow nurses joining in the calls from around the world. We hope you have been able to take away many new ideas to share with your students, colleagues, patients, friends, family, government leaders, administrators, and more. If you have missed any of the live sessions throughout this course, you can find the links and more detailed information on our website and also on the Alliance of Nurses for Healthy Environments website. Thank you for joining in today from around the world, and for all of our sessions. Education for action. This is what joins us together. Take care, everyone. Goodbye. Adios. Au revoir. Arrivederci. Ciao, ciao.